Cancer is an uncontrolled, uninhibited, dysregulated growth which does not obey the normal rules of the body. Wherever this process happens, it is abnormal, it is cancerous. Breast cancer typically happens, it's more common in women, that's why it's more of a woman topic, but men also can get breast cancer. The best thing for early detection is being vigilant about your own body. Be breast aware. The lump is very small, so the magnitude of treatment is less, the trouble associated with treatment is less, and the chances of cure are much higher. After 50, definitely every woman should get mammography screening annually. A famous Hollywood celebrity who actually underwent a genetic testing and then underwent bilateral mastectomy. There is no shortcut. There are no pills, there are no magic therapies.
Hello and welcome to the Cancer Conversation, a podcast brought to you by Delarc Pharmaceuticals. Here, we talk with leading experts to bring clarity, hope, and truth to one of the most complex topics in our time, cancer. I am your host, Ekta Kapoor, and today we are diving into a disease that affects millions of women and families every year, breast cancer. Every 4 minutes, a woman in India is diagnosed with breast cancer. It's more than a medical crisis. It's a wave of personal battles of strength, fear, survival, and hope. Today, we are here to cut through fears and myths and bring to you real answers. We're honored to welcome one of the country's leading voices in oncology, Dr. Chetan Deshmukh. Thank you so much for being with us here, Doctor. So let's start from the beginning. Most of the times when people hear the word cancer or say breast cancer, they instantly panic without even realizing what exactly is happening inside the body. So let's talk about what exactly is breast cancer, what happens.
For the audience, let me first explain what is cancer. Cancer is an uncontrolled, uninhibited, dysregulated growth which does not obey the normal rules of the body. It usually grows at a place, outgrows its supplies at that particular place, then in search of supplies starts moving from one place to the other. Wherever this process happens, it is abnormal, it is cancerous. Now it may happen in the breast, it may happen in the lung, it may happen in any part of the body. And every living organ of the body is susceptible to develop cancer.
Okay.
Now coming to breast cancer, this same process of an uncontrolled growth happening inside the woman's breast or even a man's breast is considered breast cancer.
Mm-hmm.
So, breast cancer typically happens, it's more common in women. That's why it's more of a woman topic, but men also can get breast cancer.
Oh, so it's not
It's rare, but it's there, yes.
So it's not a taboo that, only women will have breast cancer.
No.
All right.
Small but definite proportion of men, 1%. The incidence is 1% amongst all breast cancers, but yes, it can happen in men.
Okay. One of the most powerful tools that we have in today's date is early detection, right before you can even know that, it is going to harm your body. So what is it that men and women, as you specified, should do for an early detection?
The best thing for early detection is being vigilant about your own body. There was a slogan that be breast aware, and that was a very important slogan raised by the American Cancer Society several years ago, that a woman should know more about her own breast. That is why they recommend a simple self-breast examination as early as in their 20s.
Okay.
Going down to as your age goes up, you may think of adding mammography and other screening methods to it. Mammography is one of the most powerful and the most commonly used screening tools. That is going to help us detect breast cancer at a very early stage. The advantage of doing mammography is you can actually detect breast cancer even before you can feel a lump.
Oh.
And that is when the lump is very small, so the magnitude of treatment is less, the trouble associated with treatment is less, and the chances of cure are much higher.
So when we are talking about mammography or any kind of a clinical examination, ideally what should be a good age that women should or men should start doing it, especially if they have a family history and if they do not?
I'll have to answer this question in two parts because for people who have a family history, it's a different scenario. People who don't have a family history, usually the screening age is considered, mammographic screening age is 40 years. Though there is a slight debate, some people believe that you can start screening at the age of 50. Even in the United States, there are two schools of thoughts, and one school says that you start at 40, other says it start at 50. In India, we don't have a country-specific guidelines as such, but I believe that most of our cancers come a decade earlier in India. So we should start screening at the age of 40, or at least start discussing with your doctor about mammography screening at the age of 40. Whether to do it between 40 to 50 is up to the lady herself and her prescribing doctor, but they should at least start discussing. After 50, definitely every woman should get mammography screening annually.
Okay, and what if they have a family history? Then should they do it
So if they have a family history, there are certain genetic syndromes where you can do breast cancer screening even in their 20s or 30s, though the methods may not be mammography. One. Second, an easier way of remembering is 10 years earlier than the index case. Index case meaning the first person in the family who got the disease. Suppose a woman's mother had breast cancer at the age of 45. Then this lady should start screening herself at least from 35. 10 years younger than the index case.
Okay, and how often should this be done?
Ideally, annually.
Ideally, annually. Okay. So when we are talking about screening and, they should get themselves checked, are there any precautions also that they should follow, especially the people with a family history?
Precautions, you mean for cancer prevention or early detection? Because these are two different things. Most people confuse one for the other.
Right.
Prevention means you are preventing cancer.
Right.
Screening means you are detecting cancer, but at an early stage. So
True.
cancer has already happened in screening.
Right.
If at all you detect cancer, it has already happened.
Right.
But in prevention, you don't want the cancer to start at all.
Right.
So there are two different strategies. For people who have a family history, strong family history, if they have assessed themselves genetically, like a famous Hollywood celebrity who actually underwent a genetic testing and then underwent bilateral mastectomy. So if such a genetic testing has been done and the lady fulfills certain criteria and she is willing for it, yes, bilateral mastectomy can be done, and that is one way of preventing breast cancer. That is not a way of detecting breast cancer. The way of detecting breast cancer is by usual methods, mammography, cell breast examination, clinical breast examination, or in certain situations an MRI of the breast. These can be done. Now, if somebody has a family history, then we just spoke about it that depending on the age at which the index case presented, you are going to screen. For prevention, suppose somebody does not have any genetic risk. There is nobody in the family who's had breast cancer, but yet a woman wants to know how can she prevent breast cancer.
Yeah.
And there is no shortcut. There are no pills, there are no magic therapies. The standard method adopted is a good, healthy living. She should maintain her weight near normal. She should have an active, healthy lifestyle, staying away from alcohol and tobacco in all forms, keeping away junk food, eating at least 5 servings of fresh fruits and vegetables, and physical activity for approximately 150 minutes per week.
Okay.
That is what is recommended. Now, this may sound very generic. This may sound as a broad advice, but this is true for all cancers.
Okay, so this applies to all types of
All
cancers.
types.
For men and women both, right?
Yes.
Yeah. Now that we're talking about precautions, preventions, but still, if the test results come positive, the moment someone hears the word cancer, the complete world comes to a stop. So, what is it that we will recommend over here? What does the process look like from detecting to recovery to precaution? What is the whole journey like?
Okay, so let us begin with the diagnosis. If somebody gets diagnosed with breast cancer, of course, I assume that it has been done in a standard laboratory where there are no doubts about the diagnosis as such. You need to perform certain additional tests to find out whether this tumor is responsive to hormonal therapy or certain targeted therapies, or it is a different type called triple negative breast cancer. This will help us decide subsequent treatment. The second step comes about staging. You need to find out whether the tumor is limited to the breast, or it has gone to the armpit, or it has gone to other parts of the body. So that decides the stage. If it is limited to the breast, less than say 2 centimeters, then it is stage 1. If it is beyond 2 centimeters, it is stage 2. If it has gone to the armpit, then it is stage 2 or stage 3. If it has left the confines of breast and armpit and spread at other parts of the body, say you find something in the liver, find something in the lung or the bone, then it is stage 4. So usually a PET scan is done to find out what is the exact stage of the disease. There may be certain other investigations. You can even do a simple ultrasound to find out if there is disease in the liver, but doing an ultrasound separately, doing a chest x-ray separately and a bone scan separately doesn't make sense. A PET scan usually suffices all 3 requirements and you can get a complete evaluation. So then you go down to stage. Now suppose a lady has a breast cancer limited to the breast. Essentially it is probably a stage 1 or stage 2 disease. Then such patient may be subjected to either surgery or chemotherapy before, and then based on the response she goes in for subsequent treatment. If the tumor is less than 2 centimeters, if the tumor is even smaller, then sometimes women opt for surgery upfront. If she wants, she can save her breast. If she wants, she can remove the complete breast, though complete breast removal is not necessarily required. Along with that, we also do a small procedure in the armpit to find out if the disease has spread to the armpits or not. There are glands in the armpit which are examined under a microscope, and you find out whether the tumor has spread to the armpit glands or not. That is again going to decide whether you need additional treatment. If yes, then what additional treatment and what is the extent of additional treatment. So if a lady has a small tumor, she undergoes surgery, then based on the final pathology report, the subsequent treatment decisions are made. If the tumor is beyond a particular size, then this lady may need additional chemotherapy, additional radiotherapy, and women who are hormone receptor positive based on their pathology report, they need hormonal therapy for a period of about 5 to 10 years.
Oh, and then how does the recovery go after post-surgery, post-chemo? That I've heard is more traumatic. So
let's take it one by one. So recovery post-surgery. Today, breast cancer surgery is not so troublesome.
okay.
In fact, most women go home the very next day or second, third day also.
Oh, wow.
Yeah, it's a small procedure because the extent of tumor is, the extent of surgery is small. So you don't have to do a lot of dissection. So the lady is okay to go home the second day or third day also. So recovery from surgery is not a big deal. At the end of say 8-10 days, usually the sutures come off and the lady is back to work or back to her usual life. She can have a bath and do all her other activities. So that is for surgery. For chemotherapy, it's a repetitive process. You do courses or cycles of chemotherapy once every 3 weeks or once every 2 weeks, in some cases once every week. Then depending on the dose and the drug used, your recovery period is going to happen. So for a patient who has received a treatment once every 3 weeks, usually the recovery takes place after about 8 to 10 days. So 12th, 13th day onwards, the lady is feeling almost normal and she goes back to her routine. For weekly therapy, the side effects usually last for a couple of days, and then 3rd, 4th day onwards, the lady starts feeling usual. So this, as the number of cycles progress, the recovery period may get delayed because a lady may recover on the 8th, 10th day in the first course. But if it is her 10th or 11th course, then recovery is going to take a little while longer. Radiation therapy actually does not cause too many problems. The actual time required for delivering radiation therapy is about 15 to 20 minutes. Ladies often spend more time going and coming back from the place of radiation than actual on the radiation table. And it is localized. It is only limited to the breast. So there may be a little bit of discoloration, a little bit of skin involvement just locally. That too very temporary. After a period of about 2 to 3 weeks, the skin becomes normal, and a few months down the line, you won't even know where it has been radiated.
Mhm. So when we're talking about recovery, and as I mentioned, that it is actually kind of traumatic. So, what is the kind of support system that we have in our country? Say emotionally, physically, is it inside the hospital or is it in the community? How do they do it?
Well, there are multiple support systems which exist. The biggest support system in our country is our own family. Most women are taken care of by their own families, the immediate family, the extended family. There are friends, neighbors. So it's not so much of an issue because our family system is quite strong.
True.
Uh, in Western world, where families are not so strong, or women live alone, or maybe with partners, or far away from their families, there they have a concept of support groups, which is also picking up in India. There are support groups in most big cities. They are dedicated breast cancer support groups. There are even cancer support groups. And these ladies often take care of their fellow members. They help them with logistic support, like dropping them to the radiation unit, ferrying them back from the radiation unit, or sitting with them during their chemotherapy, or accompanying them for hospital tests and all. These support systems do exist. Unfortunately, it's not in a very big way because we have a family support system. It is very rare for a lady to come to the hospital unaccompanied. It's usually someone, either her spouse or her children, or somebody from her in-laws, or somebody from the neighboring families will accompany that lady. So that's not so much of a problem. But once, as our families are becoming nuclear, as our family size is getting smaller and smaller, we are going to need these support systems, and these support groups are there. There are some hospitals who have patient friends. So you go there and you tell them that this patient is alone and she will need help. So they accompany these patients. At some places, it is a free of cost service. At some places, it is a paid service. But nevertheless, these services exist, and it is a very important support group, support system. So that is one thing. Second is, in my experience, neighboring patients, typically patients receive chemotherapy, breast cancer patients receive chemotherapy in wards or in the daycare. And the lady on the next bed often counsels my patient that, well, this is what happens, don't worry about it. And they form a nice bond, and they usually take care of each other very, very well.
So now once all of this is done and once there is the complete treatment is done, I don't think life just snaps instantly. So what does life look like post treatment for survivors, and how important is it for ongoing monitoring even after recovery?
Yes, life doesn't snap back to complete normal, but over a period of time, typically for our breast cancer patients, over a period of say 4 to 6 months, it usually comes to normal. Their physical appearance comes back to near normal in a span of 6 to 8 months. If they have lost hair, their hair grows back, not to the original length, but yes, socially acceptable hair grows back by 6-8 months. Whatever other physical effects have happened as a result of surgery or radiation or chemotherapy usually go away by 6 months. So at the end of 4 to 6 months, a lady is almost normal. And if she is mentally strong, then she is back in action even sooner. So recovery is not a big deal. It happens over a period of time, and it is sure to happen. That is one thing. Second is about follow-up. Follow-up is essential. Follow-up is for two things. One, of course, there are certain women who require regular treatment. There are some women who take a targeted therapy for a year. So their treatment goes on for a year. There are some women who are hormone receptor positive. They take hormonal pills for a period of 5 to 10 years. Sometimes there is more than one tablet. So these women also need to follow up to find out if they are having any side effects of these tablets. Regular monitoring of that side effect is essential. So these women also need to follow up. A third important aspect of follow-up is to detect if the disease has come back. And that is even very, very important, because if the disease does make a comeback, then it is wise to check it in time to find out if it has come back when it is very, very small, so that it can be tackled in a better way, rather than coming to know about the disease when it has spread all over the place. This is the third important aspect of follow-up. And the fourth important part, which patients often forget is a lot of scientific information keeps changing. So what we learned 20 years ago is probably not so relevant today, because our science changes almost every year, every month. There is new data coming in. So if there is any new data which has to be shared with the patient, only a patient who's on regular follow-up can be given that information.
Right.
It is impossible to keep track of patients who has come, who has not come. We usually don't call up patients every now and then, but a patient who is regularly in front of us comes for follow-up. This data can be easily shared. Like screening, genetic testing. Genetic testing was virtually unheard of a few years ago. Now, genetic testing is routinely done. It doesn't cost a lot. The treatment for a genetic defect is not so difficult. It is quite accessible now. So this information will only be given to people who regularly follow up. Otherwise, patients who don't keep a follow-up are likely to miss these things. And the fifth important thing is long-term side effects of treatment. Sometimes chemotherapy-related long-term problems can surface. Some of the surgery-related problems can surface at a later date. Radiation-related problems can surface at a later date. These problems can be detected only if a patient is following up.
Right.
That is the most important part. Another important thing about survivors is maintaining health of survivors. Often we see that once a lady has completed her breast cancer treatment and she is fine now, she takes it too easy, and then weight goes up, their bone health goes down, cardiac issues start surfacing. So they have to take good care of themselves. They've just had a nasty shock. They've recovered from the shock, but then they should make good use of this shock and lead a normal life. They should not let their health go awry in the course of time. They have to maintain that tempo, maintain that discipline for many, many years to come. That is very important.
Right, just like you said before, that when we're talking about prevention, they have to maintain a healthy lifestyle. So obviously, even after the treatment for the survivors, they should be doing it more than needed, right?
Absolutely.
So how long does this follow-up go on? Should it go on forever?
No, not really. Well, most of the patients decide how long they are going to follow up, but we recommend a follow-up for at least 10 years.
Okay.
After 10 years, we tell them that you continue doing a mammography. And if the mammo is fine, then you need not even visit the doctor. If it's fine, just let us know that the mammo is fine. And then that's good enough. Most patients prefer to come and see us once in 2 years or once in 3 years, just socially, and sometimes just to have a quick check that everything is all okay.
Right. So now that we've spoken about precautions, about treatment, and also about post-treatment, let's talk about the biggest barriers, the myths. So there are a lot of misconceptions that you must be hearing, especially from families in India, which are revolving around breast cancer. So can we do a quick rapid fire kind of a session now?
Sure.
The first one that I have heard is that women with heavier breasts get breast cancer for sure.
That's not true.
Any kind of a lump is cancer.
Not true.
Okay.
Because every lump is not cancerous is a half-truth statement.
Okay.
A woman who is postmenopausal, okay, meaning she's had her menopause a few years ago and now she comes with a lump in the breast. We treat such lumps as cancerous unless proved otherwise.
Okay.
So if a young girl, say about 18, 19-year-old lady walks into my office with a breast lump, I know for sure that it is very unlikely to be cancerous. A 30, 35-year-old lady walks into my office with a breast lump, I'm going to examine it. I'll be properly evaluating it before I'll start looking at it as a cancerous lump. But if an 80-year-old granny walks into my office with a breast lump and a biopsy which says that it is not cancer, I'm going to repeat it or I'm going to get it rechecked.
Okay.
So every breast lump is not a cancerous lump, that is true. But in certain situations, I'm going to look at every breast lump with suspicion. A lady with a strong family history of breast cancer, a strong family history of breast and ovarian cancer, a lady with a proven genetic mutation, BRCA mutation. If she walks into my office with a breast lump, I'm going to look at it with a lot of suspicion.
Right. So the next question would be that it is connected to this one. If no one in my family has breast cancer, I can never get breast cancer.
No, that is a myth, because there are many women who get breast cancer. It's called sporadic breast cancer. You need not have a family history, and you may get breast cancer even without a family history.
An injury can cause breast cancer.
Very unlikely. Injuries, because usually injury happens once in a while. It's not a repeated injury. So breast cancer because of an injury is extremely unlikely.
Okay. Now my favorite one, that there are some fruits, some herbs, some diets that can cure cancer permanently without any other medical procedure required.
This is a myth because there is no science behind it. To elaborate a little on it, whenever we say that a particular treatment is effective, this treatment has been tested in a group of people under very, very controlled conditions. We call it a clinical trial. Say one group of people is given treatment A and another group is given treatment B, and then you compare their results and say that, well, treatment A is better than treatment B. Unless such studies are done for herbs, fruits, exotic diets, or whatever remedies which are promoted, there is no reason to believe that they have any effect on cancer. Without data, you should not believe in any of these, and data should be of a sizable number.
Right.
So there is a very basic concept of statistics that whenever you look at a study, you need to look at the sample size. If you have sampled only 10 people, so somebody comes to me with a study that I have done a study of XYZ fruit in 10 women, I'm not even going to look at it because it's a very, very small sample size for the magnitude of problem of breast cancer. Breast cancer is diagnosed to almost hundreds and thousands of women. So you need a sample size which is at least 1,000. If you have 1,000 sample size which tells me that yes, treatment A is better than treatment B, I'm going to believe it. For a 10 or 5 or anecdotal evidence that XYZ had breast cancer and he or she took this treatment and became all right, we are not going to believe it, and nobody should believe it.
Right. So when we are talking about fruits and herbs and different kinds of medicines, this one is a very sensitive topic about, especially in India, about home remedies. There are people who create different kind of remedies, different kind of drinks from all kind of Ayurvedic medicines, or maybe it's some things, as people say that, in Indian kitchen you can find the
Dispensary of the world.
Yeah, it is. So how accurate do you think that is? And as a doctor, what would you recommend?
It is extremely inaccurate to label our kitchen as a dispensary. First of all, nobody should dispense medicines unless he or she is a doctor. So seeking medical advice from my mother or my aunt or my grandmother is highly inaccurate. One should not be doing it. That is one thing. Second is about Ayurvedic remedies. Now, the same remedies, the same home remedies which people like to opt for have a very different connotation or a different context in Ayurveda. So unless somebody has read Ayurveda, unless somebody has studied Ayurveda, or unless somebody is an expert in it, I don't think we should even venture into it. I'm not an expert in Ayurveda. I know nothing about Ayurveda. So I never offer any Ayurvedic therapy to my patient because I don't know any of these medicines. One. Second, it often is said that if you mix two chemicals, the end product or the product which is going to result due to mixing two chemicals may have very different properties. People often try to mix home remedies with regular chemotherapy or hormone therapy or other therapies. That can be risky because if the chemotherapy chemical and these home remedy chemicals mix together, one cannot even imagine what kind of side effects it may produce. Some people take these home remedies or alternative therapies to reduce side effects. Now that again is a very tricky thing because side effect is nothing but an extension of effect. So if you want to reduce side effect, your therapy or these remedies have to be so accurate that they have to stop only the side effects and not the effect. I don't think such an accurate therapy exists.
Right.
So some of our patients who take these medicines to reduce side effects often end up reducing the effect as well. And in that bargain, they lose, sometimes they lose control over their cancer as well. So that is a very, very risky idea. I won't recommend it. I don't think there is any science behind it. Again, coming back to the same previous discussion, unless you have very strong scientific evidence, one should not opt for these things.
So when we are talking about Ayurveda, as in, so now I understood one thing, that if you do not know anything about a particular science, even Ayurveda is considered to be science and that's how it is taught. So when we are also talking about this, there's also this thing that has come up recently, alternate medicine. What is your view about alternate medicine for breast cancer here?
Same. Absolutely no science behind it, so should not be recommended.
Right.
There is no science. If so-called alternative medicine specialists have any data worthwhile showcasing it, they should do so. As of now, there is no scientific publication which unequivocally tells me that it is effective against breast cancer.
Okay.
So, as of today, we cannot believe any of their claims.
Right. So when we're talking about home remedies or alternate medicine, I think it would be something that what you said earlier, that have a healthier lifestyle. And that's your only home remedy that you can follow other than following the basic clinical explanations that we have. Right?
Absolutely.
So when we're talking about alternate medicine, home remedies, another favorite part of mine is unproven therapies. And have you ever experienced people who have tried any of these? How dangerous they are? And also, can it delay the proper treatment what you are doing?
Wow. So many questions, but let's take one at a time.
Okay.
So, first of all, most of the so-called alternative therapies are unproven. There is no science, there is no published literature for any of these. So, they are all unproven. Second thing, have I heard of unproven therapies? Have I seen unproven therapies? A lot. We can make a book. So, let's not go into too much of detail, but to give you a few examples,
Yes, please.
goat's milk, auto urine therapy, mud therapy, cow's urine therapy, and multiple cow related products. People somehow feel that anything which comes out of the cow is great, and that is how they end up getting all kinds of infections. The disease spreads, the disease goes on increasing, and sometimes it comes in such a bad situation that very little can be done for the patient. People opt for them because they feel it's a shortcut, or somebody has told them that they work very well. They unfortunately don't work at all. On the contrary, they delay regular treatment, and in that bargain, the disease increases.
Yeah.
So, delaying treatment, causing dangerous side effects, all these are there. Another important aspect is people who try these unproven remedies without a diagnosis. Sometimes a lady just has a breast lump and she decides to take these unproven therapies, and it usually either creates more trouble or it just simply doesn't work. So, my suggestion is, if you have a lump, first get it assessed, know what it is, and then treat it as per your wish.
So in continuation to this, doctor, I would like to know that if someone is going still, despite even after listening to us, still wanting to go ahead with these alternate medicines, home remedies, or whatever we're talking about over here, why is it important that they should first try and speak to their oncologist and then maybe take the decision?
They should speak to an oncologist because the oncologist is going to give them a proper diagnosis. He is going to give them a proper treatment plan with the pros and cons associated with it. Based on this information, they are going to take an informed decision. And most of our patients who come to us for either a consult or information are usually satisfied with whatever information we give in a very scientific manner. And that is why they continue taking treatment with us. There are a few who have a lot of fear in their mind about chemotherapy, about radiation therapy, about surgery. So, if they sit and discuss with the specialist, I'm sure most of their fears will be allayed. It is it is a common thing for my patients to say no to chemotherapy at the first consultation. They just don't want to hear the word. But once they come to terms with the disease, once they come back to me for more information, once they understand, once they see people around them taking chemotherapy and going up about their usual life normally, they come back to us and they take treatment.
Right. And what is your view about these complementary services that we have, like yoga, spiritual healing, meditation? Even this, they say that, it can help cure cancer mentally, is what I've heard. So is that true?
So you use the right word. They are complementary. They are not alternatives.
Right.
They cannot be alternative to standard therapy. If somebody is going through standard therapy, surgery, chemotherapy, radiation therapy, hormonal therapy, targeted therapy, and on top of it wants to do yoga, go ahead. Wants to do physical activity, go ahead. Wants to do some spiritual meditation or something, please go ahead. No problem. But use it as a complement. It can be a supplement to main therapy. It cannot be an alternative to main therapy.
Right.
The standard scientific therapy has to be done. There are some women who regularly run on the treadmill during their breast cancer treatment. Fine, go ahead. If exercise is something which you love doing, please go ahead. In fact, we encourage exercise to all our patients, that they should go about doing at least simple exercise which is not very exhausting, which is not very tiring, and depending on their physical status, they should exercise. So exercise is fine, yoga is fine, spiritual fine. They can attend religious discourses, they can read books, they can try mind health, improving mental health, positive energy, positive health. Everything is welcome, but as a complement or as a supplement to main therapy.
Right. Doctor, with everything that we spoke about, let's just conclude this discussion with a final message for those who are either fighting breast cancer or supporting someone who is fighting breast cancer. What is one final message that we'll give them?
Breast cancer is preventable, it is screenable, it is detectable at an early stage. If detected early, it is definitely curable. It can be treated at all stages, and women should face standard scientific treatment with courage.
Right. And for people who are supporting someone, what is the one line that we can tell them? How can they make it better for them?
Keep up your faith and hope. The treatments are good. Treatments will work. Have faith, support treatment. The end result will be good.
Right. Thank you so much. Thank you so much, sir. To our listeners, breast cancer is beatable, but only if we face it head on, know the symptoms, get screened, and don't wait. This has been the Cancer Conversation by Delarc Pharmaceuticals. If you found today's episode helpful, share it with someone you love and join us next time as we continue to decode cancer with care, empathy, and science. Until then, stay informed and stay strong.